what kind of lessons or what kind of experience we can share, that there are so many things. But however, I should say that the most important thing, when we are talking about, when we are combating the infectious diseases such as the COVID-19, is to prevent and to control the disease rather than treatment. So treatment is only secondary. Prevention and control is primary effects that you can take and you can learn from what we said. Last time I remember that talking about plan, you must have plan. And actually, failure to prepare is preparedness for failure. So even now in Wuhan, in Hubei, we have fewer and fewer newly diagnosed cases. And we should remain alert. And we should prepare for the future sporadic cases and the future imported cases, and to learn from our own experiences, from our own success and failures. Thanks.
Yes, Dr. Yan, please.
To my overseas colleagues, I want to address two points. The first is the doctors, you should take good care of yourself from the coronavirus infection, because this is the precondition for you to take care of patients. Also, it's a precondition to protect your colleagues and your family. My second point is the public should be educated widespreadly to protect themselves. The measure is not so complicated. Just wash hands, wear mask, and avoid gathering, etc. Otherwise, the healthcare facilities and systems will be overwhelmed because of the outbreak of COVID-19. Thank you.
Okay, Dr. Wu, please.
I want to share a few words. For the general public of other countries, I want to say that we totally respect that every nation, every people, you have your own condition that could be very different from others. We are not saying that, well, this is Chinese example and you should follow. We're not saying this. We totally respect that. You should take your own actions. But every one of us should take this very seriously. Take necessary actions, change your behavior, and be responsible. For the medical community, I would like to say that we have to protect them, because in the last few days, we know that our European colleagues are also contracting the disease during their daily practice. And the proportion is quite similar to the earlier time in Wuhan. So we need to protect our medical staff. Also, working in the ICU, the environment is quite stressful, and the mortality is relatively high. As a physician, you know, from time to time, you will lose some of your patients, no matter how hard you have been trying to save their lives. Though this could easily damage the morale of the ICU staff. So my suggestion is that rest and relax is very important. You need to take very good care of yourselves. Thank you.